This presentation was supported by contract number HHSS 2702017-00001C from the Substance Abuse and Mental Health Services Administration, SAMHSA, co-funded by Children's Bureau, CB, and the Administration on Children, Youth, and Families, ACYF. The views, opinions, and content of this presentation are those of the presenters and do not necessarily reflect the views, opinions, or policies of SAMHSA, ACYF, or the U.S. Department of Health and Human Services, HHS.
Medication-assisted treatment, or MAT, is a treatment approach that combines medication with counseling and mental health therapies. Despite the empirical evidence demonstrating MAT to be more effective for opioid use disorders than other substance use treatment without medications, MAT continues to be misunderstood and underutilized. The purpose of this motion graphic is to address some of the common misconceptions surrounding MAT and offer effective strategies that courts and child welfare agencies can use in their practice. One of the most common misconceptions about MAT is that recipients are simply substituting one drug for another. Some judges and caseworkers share the view that parents are not actually in recovery until they are off the MAT medications. These types of views can influence case planning and permanency decisions. MAT is not replacing one drug for another. The medications used in MAT relieve the withdrawal symptoms and psychological cravings that cause chemical imbalances in the body. Heroin, for example, causes an almost immediate period of euphoria that wears off quickly and ends in a crash, causing intense cravings. The cycle of euphoria, crash, and craving, sometimes repeated several times a day, is indicative of addiction and results in severe behavioral disruptions. In contrast, medications used in MAT, such as methadone or buprenorphine, have gradual onsets of action and produce stable levels of the drug in the brain. As a result, people maintained on these medications do not experience the cycle of euphoria, crash, and craving as they do when they use illicit substances. To further distinguish MAT medications from illicit substances, MAT medications are closely monitored by a medical professional, and research has shown that when provided at the proper dose, medications used in MAT have no adverse effects on a person's intelligence, mental capability, physical functioning, or employability. By controlling the symptoms of substance use disorders, such as withdrawal and cravings, parents can stabilize their behaviors, engage in treatment services, and build a support system that is beneficial for both them and their children. Another common misconception is that there is a set amount of time that a person should use MAT, and any use past this time is unnecessary or even harmful. With this misconception, judges may expect parents receiving MAT to be stepped down from methadone or buprenorphine as soon as possible. And child welfare workers may be concerned that long-term use of MAT is not compatible with successful parenting. While a rapid step-down of MAT may be feasible in some cases, this expectation is not realistic for the majority of parents affected by opioid use disorders and child welfare involvement. People may safely receive MAT for months, years, or even a lifetime, and similar to other medications for chronic diseases, people should discuss plans to stop MAT with a doctor before doing so. Another misconception is that MAT is not an appropriate treatment approach for pregnant and parenting women with opioid use disorders because of the potential adverse effects it may have on the developing fetus or infant. However, MAT has been identified as the best treatment option for healthy fetal development because it has proven to help the mother engage and adhere to treatment, reduce the risk of relapse, reduce the risk of overdose death, and reduce the risk of contracting associated infectious diseases such as HIV. Misconceptions surrounding MAT can perpetuate stigma, ultimately limiting parents' recovery options and lowering the likelihood of family reunification. Targeted messaging, ongoing training, and cross-system collaboration are effective strategies to debunk the misconceptions and promote a better understanding of MAT. Targeted messaging is important to reiterate that MAT is an evidence-based treatment approach that includes not just medication, but a program of counseling and mental health therapies. Ongoing training could take many forms, including online courses and toolkits to promote education and awareness of the research and outcomes associated with MAT. Cross-system collaboration should include developing a shared understanding of the various service providers that these families are involved with. This shared understanding helps to promote trust and increase communication between child welfare agencies, courts, and substance use treatment providers.
For more resources and to learn about this topic, please visit https://ncsa.gov/medication-assisted-treatment.aspx and https://www.samhsa.gov/medication-assisted-treatment.